Good evening, everybody. You're welcome to another insightful and powerful webinar. I really want to appreciate you for staying around. I know we said 8, but due to some issues, we could not start on time. I want you to invite someone in the next 2-3 minutes. I want you to invite someone, share the link with someone, and tell them about this webinar. Share the link with someone and invite someone for the webinar. Yes, while we are doing that, let me quickly introduce myself. My name is Nurse Badakin Rhoda Moturayo, RN, registered nurse, registered midwife, registered public health nurse, and I'm the team lead of Team Favorite Nurse. Together with my awesome colleagues, we make up Team Favorite Nurse, and we're about helping people make healthier choices. And this is one of the ways we help people to make healthier choices by enlightening them on certain topics that they are not quite familiar with, and such as this. So tonight we'll be having physiotherapist Ayodele Fogofoluwa. And guys, I don't want you to miss the session for anything. So in the next 3 minutes, I'll be welcoming him on stage. But before then, I would want to read out his bio. Can we hear me? Can I be heard? Can I be heard? Can I be heard? Can I be heard? Please, if I can be heard, can you please let me know in the comment section.
Disconnected.
Thank you, Miss Boluwatife Olawole. Okay. So, I don't know if we can still remember why we are here tonight. I don't want to waste our time, but I would have loved to hear from us who can remind us our topic for this webinar. But let me help you out. We are discussing low back and knee joint pain. And this is very important because even we that we are young adults, we are facing this, let me say, problem, because every day we complain of this knee pain, back pain, everywhere pain, joint pain. So we thought it very important and needful at a time like this to bring up seasoned people and seasoned person like physiotherapist Ayodele to take us through the whole process of what these things are, what causes it, what we should know and what we should avoid, and every other stuff that we should do. So I'll just go ahead to read his bio. Ayodele Fogofoluwa is a passionate physiotherapist who works at the University of Ilorin Teaching Hospital, Kwara State. He graduated from the University of Ilorin, emerging the best graduating students, orthopedics and musculoskeletal physiotherapy. As an undergraduate, Fogofoluwa was actively involved in developing his departmental association, the Nigerian Association of Physiotherapy Students, that's NAPS, in the Ilorin chapter, where he served as president. During his service, he led several community outreaches in Ukioi, Taiwo, and Oko, steering initiatives that promoted practical health education, preventive care, and campaigns on proper ergonomics and musculoskeletal health in everyday life. He's a Christian and a leader who is devoted to bringing out the good in his profession, his colleagues, subordinates, community, and everyone around him. And he's also a deeply passionate musician. Without further ado, I want to invite physiotherapist Ayodele on stage. I don't know if, yeah, please let's welcome with our chat, with our comments in the chat box. Let's welcome him. And because of one or two reasons, we won't be able to see his face tonight, but definitely another time. Good evening, sir.
Yeah, good evening. Good evening. Again, I apologize for um not being able to show my face at this time. I'd planned to do that, but I'm in an inevitable situation at the moment. It's quite dicey. Thank you so much for having me, and it's absolute honor to be here. I hope I can be
Well,
heard very clearly.
yes, yes. I can hear you,
Okay.
and I think that others too can hear you. Thank you so much for honoring our invitation. God bless you.
Amen. Amen. It's difficult not to, even if I would try to probably make light of it. It's a very, I just went through a little of what this um what this group has done in the past, and it's a it's real value to the community. It's of real value to the community, and there's some part of it that I will be addressing, in tonight's topic. Yeah, low back and joint pain, practical measures for prevention and relief. Okay, I don't know. Are the slides up yet? Okay. Um, okay. So do I wait for the slides to come up, or do I go on notwithstanding?
I think it's
Mm,
network issue. We can't really.
okay.
Okay. Hello.
Yeah, I was asking
Okay. Yeah.
whether this. Yeah, I was asking whether the slides can be put up.
Oh, my, what's it called? My network went off. Yes, I can. Let me just put it up now.
Okay, thank you. Okay. All right, perfect. So yes, low back and knee joint pain, practical measures for prevention and relief. Okay, let's dive into it right away. So we can move to the next slide. Yeah, so today's conversation is about equipping you with practical knowledge. Practical knowledge, it's put in bold for a reason. To better understand, prevent, and manage low back and knee pain. And these are two of the most common complaints in our everyday lives. And um, there's something that I have been thinking about in this period, most especially like this week and the previous week. Um, there are electrical problems that you could have at home, and you might not necessarily call an electrician to fix, right? So every time your bulb probably dies out, you might, well, some of you might still go and call an electrician to change your bulb. But if you're like me, I would just fix it myself. Yeah, there are certain measures that I will take. I don't need an electrician to tell me, not to turn on my iron and just leave it on, like plug my iron or plug a kettle and just leave it on. I don't need a bonds specialist to tell me not to turn on my gas, just like that. I don't need a plumber to tell me that I should not leave my tap running. I can leave the tap running and my house gets flooded. So what I'm just trying to say is that in every single profession that exists, there is a digestible portion that is given to every single person, such that we would even limit the number of cases that we now have to bring to the specialist. So, for instance, as a physiotherapist, the only reason why I should be seeing you is if all the things that you could have done at your level have been exhausted, and now you need a specialist to see you. So, for instance, my meter blows up. I can't fix that. I have to call, the electrician or the PHCN guys to come and fix that. So, just in layman terms, you can take this as something of that regard, like changing a bulb or fixing a light bulb. I don't let me even say fixing a light bulb, not letting your appliances burn down, yeah, just by yourself. That's the reason for this, and its its prevalence is what makes this necessary. Yeah, if it wasn't something that was rapid in our community, then, or was very prevalent, let's just stick with prevalent. If it was not something that was prevalent in our community, then there would be no need to teach it to everybody. If it was just one person, out of a million people that were feeling this, then it might not be necessary. But imagine 9 out of 10 people are having a problem, and these 9 people are going to the specialist when it could have easily been taken care of at a simple level. So it's it's loss for the person. It's also loss for the professional, because they would have to be dealing with small fry when they should be dealing with the harder things. And of course, the person in themselves, they would, I mean, the patient that would eventually come down with something chronic at their own basic level. You don't need a nutrition and dietitian to come and tell you that you should eat well, they will tell you, but they won't come and feed you, and they won't come and feed you the balanced diet. Yeah, they will just give you the education so that in your own home you can do the right thing. So you can see this, um yeah, you can see this in that light. Basically, it's necessary. So let's move on to the next slide. The next slide. Mm, mm, mm. Okay, so I think I might have to just go on. um I would just go on and okay. Yeah, so still on the introduction. um okay, we're here. Very good. So yeah, low back and knee joint pain are among the most common musculoskeletal complaints globally. Yeah, we're not talking about shoulder pain or, well, neck pain, even though that is still relatively prevalent. Or let me use this, like, I don't know, finger pain. Yeah, or yeah, we're not talking about those ones. Not that they don't exist, but again, the prevalence is what guides the you know guides us throwing our where would invest our efforts. So that's why we're looking at this. Knee pain has a global prevalence of 46.2%, while 75 to 80% of people experience low back pain in their lifetime. I think everybody. I know that. Yeah, I know that. Of course, this is the statistic, but every almost nearly anyone, yeah, in the even on this call right now, I'm sure we've experienced low back pain at one point or the other. I myself, as a physiotherapist, I experienced low back pain. Yeah. So because the low, which we're going to look at that about why it is that prevalent in the low back. So yeah, the work culture in our environment places heavy burdens on the knees and the low back. Next slide. Yeah, so it affects all age groups, including healthcare students and professionals. yeah, of which might the communities where most of us might be present. Yeah, so it's often taken casually at the early stage until it leads to disability, reduced quality of life, and productivity loss. Yeah, so this is one major thing about these musculoskeletal pains. You see, one of the things that I think the physiotherapy profession suffers from is that the things that we have to manage, they don't seem so grave. You know, when you come down with a fever, you know that you can't do it's because it's immediate. It's like, oh, I have a fever right now. So you, by the time you are down and you can't go to work, you can't do anything. Of course, when it begins to affect your life and you begin to lose, it would inform you, showing up at the hospital. But I mean, if you have a little back pain here and there, you probably won't really bother to check whether there's really something serious going on there until you can't now go anywhere, until you now find yourself being unable to sit down for more than an hour to study. You find yourself being unable to do basic things. You can't lift things anymore. Your knees are paining you after something little. That is, and at that stage, it has probably gotten very, very, very bad. So that's when most people end up coming for physiotherapy. And really, I pray that at the end of this, you would heed to counsel. Yes. So understanding prevention saves our future. Really, it's just you taking care of a problem that is is likely going to meet you in front, taking care of it right now. So yeah, so the objectives are to identify the common causes of low back and knee joint pain, to apply preventive strategies um, effectively, to highlight practical relief measures and understand the physiotherapist's role in managing these conditions. Next. Yeah, so the structure of the low back in layman terms, yeah, it comprises the lumbar spine. That's the spine mostly refers to the vertebrae, which are the vertebrae, which are the beg your pardon, a minute. Yeah, so sorry about that. Yeah, the lumbar spine, yeah, that refers to the vertebrae, but in layman terms, they are like bones stacked like blocks, basically, from L1 to L5. The L stands for the lumbar. It's I would show something in the diagram in the next slide. Yeah, it's the home of the spinal cord. So many of us might have heard something called the spinal cord. Just know that it lives there. There's a space that it just runs through. It's like stacking rings upon each other and then putting a pipe inside those rings. That's it. So those discs are like the between every bone. They're like cushion pads. They help it to move here and there. If not, there will be much friction between them. So the muscles attached help the spine to move and maintain its stability. On a basic level, the muscles of the spine mostly have two jobs. Of course, movement and to stabilize the spine. So when you are in an awkward position, there is a muscle that is keeping your spine erect. So when you bend down, there is a spine that is preventing you from just toppling over, that is holding you. So these are stabilizers. When you are trying to kick a ball, you're trying to kick a football, there are muscles in your spine. Yeah, when you're walking, there are muscles in your spine that are keeping your back erect. Yeah, so you being able to sit down, you being able to stand up, it's not a given per se. It's like a very silent job that they do. Yeah, it's not like moving the kind of movements that we see, but they are there to just hold it down. Basically, that's their job. So we can move to the next slide. Yeah, so this is just a. It's called a coronal view. Yeah, the top view of a typical vertebrae. Don't want to bore you with some things you might not be concerned with, but you see that the bluish thing there. So the that is the the disc that I mentioned. There's a liquid substance that's inside it that absorbs shock, that just allows for fluid movement. Yeah, let me put it that way. So that's it. And of course, if there is wear and tear in that particular thing, like in the surfaces of it, the cartilage that encapsulates it, um, there is pain. There is pain, and there are worse things than pain. The if the structures become even too lax, they can begin to bulge out. That's what we would call a herniation. And if it bulges out, remember that there's a spinal cord that is inside those things that are stacked. So eventually you'd have that disc touching the spinal cord. And once it's touching the spinal cord, it's like, imagine cutting a wire from its origin, you know, a wire that leads to a socket downstairs or something like that. So that socket is probably not going to work, or the socket might blow, even though nothing is happening at the socket in itself, but there's something above that, maybe water has poured on the wire up. So um yeah, that's the gist of some terrible things that can happen if we don't take care of our backs very well. Can we move on to the next slide? Yeah, no, the back. Yeah, so that's just no, the next one after this, the side view, the sagittal view. Yes, so this is what the spine looks like. There's You can see there's the cervical, the thoracic, and the lumbar spine. You have the sacrum and the coccyx um below that. So the lumbar spine, that's where your low back. That's your low back basically. You know that most of the movements that you make with your body happens at that level, at the level of your thoracic spine, the place where you have your chest, where you have your ribs and all those things. They don't really move. Yeah, they don't move much. So the lumbar spine is the one that moves, and because the lumbar spine is the one that moves, it's the one that is subject to degeneration. It's subject to spoiling. It's like there's a shoe that you're wearing to school or to work every single day. Of course, that shoe is more susceptible to spoiling than that your special Christmas shoe, that you pick up once a year, or you never even pick up. It's just in your house for decoration, so that your guys can know that you're not small. Yeah. So in essence, that's it. That's what happens. So if you are going to take care of any shoe, it will be that one you're wearing every day. If you're going to have to wear that shoe every single day for the rest of your life, then that means that you're going to have to take care of it, because the chances of it spoiling by default are already very high. Yeah, but it's inside, and you can't really see these terrible things. Of course, if you're bleeding outside and you can see it, you'll be able to appreciate it and you will do something about it. But when these things happen in your low back, you are not really able to comprehend how bad it is. So that's the reason why there's so much room for carelessness. And the hope again is that you will take good care of your back. Anyway, but there's one of our guys that I'm going to talk about that helps us to preach this message more than anybody. So next slide, please. The next slide. Yeah, so this is the knee joint here. It's a hinge, basically like opening a door, closing a door, that kind of thing. Yeah, so you see there, you see the femur, you see the tibia. Don't need to bore you with many details, but there are several structures in there that enable it to move as as necessary. The knee takes the weight of the body. Yeah, the knee takes the weight of the body, so it has a lot of responsibilities. So there are ligaments, medial collateral, lateral collateral. You see the menisci, everything, just trying to make sure that it is positioned in a way that it can accommodate the weight of the body. But then there can be excesses. Once there are excesses, we have problems. There's a fluid in these joints that allows for its lubrication. It's like you putting oil at the hinge of a door. Yeah, it's synovium, and it is, let's say it's triggered by movement. Let's put it that way. It's triggered by, or its production is triggered by movement. So the more you move, the more that thing produces the synovium, and the more fluid your the movements. So next slide. Next slide. Yes. So the function, this is like the purpose of these two wonderful parts. This is what they were sent to do, literally. This is their job description. So this one, it helps you. The low back helps you to walk upright, sit, to lie down. It carries the weight of your upper body. It supports your balance and your posture, like I said earlier. It helps you to bend, to twist, and to turn safely without it holding you together. If you just turn like this, you will just see that your upper back is on the ground or something like that. Yeah, and the knees, they help you walk, climb, sit, stand up. Carries your body weight as well at that point. Yeah, it absorbs shock during movement. It helps you stay balanced on stairs, on uneven ground. You would know that when you are climbing those kind of uneven places, your knees are really triggered. Like you would really feel it at that point. And if you've ever had knee pain, you will know that it is when you're climbing stairs that you feel it the most. If you were testing the pain before, when it's time to climb stairs, you will now know that you have to calm down. So it helps you lift weight at all. If you, yeah, everyone. It's not even just about going to the gym. Everyone has to carry one thing or the other, and you need your knees to keep you. I would talk about lifting techniques later in this. Let's move on. Next slide. Covenant says you can relate to knee pain. Yeah. All right. So these are enemies of movement. Yeah. So we're supposed to move. We're all supposed to move. We're born to move. I mean, we have to move to accomplish anything at all. We have to move. Yeah, we have to move. That's about it. Um, even your lungs have to move. Even the blood in your body has to move. Yeah, the oxygen, everything is moving. Even intracellularly, everything is moving. So really, everything is movement is everything. So there are tiny movements, and I mean intracellular movements, and there are these movements big, that we can appreciate externally. So the enemies of this movement, now I'm talking about the general ones, well, they still end up affecting the tiny things that happen. Like I said, if you don't move a joint, it doesn't produce synovium, and that's an intracellular kind of thing. So the big still affects the small, even as the small affects the big. Yeah, so improper joint alignment. So imagine that your, how do I even put this in layman terms? Imagine giving a little boy load to carry, okay? Then the boy now carries it on his pinky. What's going to happen? Like, he carries it with his little finger or something like that. It's, you're giving it more than it ought to have. Like, the body was designed to bear weight in a particular order, like based on everything, based on the shape, based on the nature of those joints. They were the ligaments and everything. They were designed to they were designed to bear weight in a particular way. So when you disobey that way, you are burdening it more. So it's like me standing on one leg, and then you are now giving me something to carry. It's just very difficult. It's, yeah, it's just very difficult. Yeah, so bad posture as well. The weak muscles, of course, muscles are weak, you can't really do much. If my legs are not strong enough, I can't walk. Tight muscles. If my muscles are tight, then I cannot um I cannot reach the range that I'm supposed to. Yeah, let's keep it that way. If it's tight, then it can't open up as it needs to open up. I think the hamstrings are probably one of the most prevalent tight group of muscles. The hamstrings are the muscles at the back of your thigh. Yeah. So those are and they end up having a role to play in the low back pain. Because when you have tight hamstrings, it ends up affecting the gait pattern. I will still explain what. Okay, improper gait. So let's just tie it together like that. Yeah. So the gait basically means walking pattern. When you have tight hamstrings, there are certain degrees in which knee are supposed to the knees are supposed to flex, and the hip even is supposed to be flexed in certain ways. The That reduced range of motion for the hamstrings ends up affecting the lower. So, and it's a it's a very day by day thing. It's not like once, no, it's like little drops of water making a serious problem in the ocean. Yeah. So the enemy's tools, yeah. So these are those things we just mentioned. These are the ways in which the they cause those problems. So poor posture, slouching. You're sitting on your chair, and then your buttock is far from the angle, the depth of the chair. That's an evil weapon. It's a bad weapon. You are or you're fighting yourself. You're antagonizing your own movements. That's what's happening there. Yeah. Improper lifting techniques. Just carrying things anyway. Even if your spine is bending in 7 ways, or I don't know, your spine is bending very very awkwardly, you're still carrying it like that. Yeah. So when you have weak back muscles as well, like I said, your back muscles have a lot of responsibility. In fact, I can almost say that there is no movement that you make in the body that does not end up affecting the back. If you want to reach for a cup, if you want to reach to collect something, you use your back. But it's your hand you're using, so you won't know that it's your back, but it's still your back. If you want to sit down, it's your back. If you want to stand up, it's still your back. Everything is your back. Yeah. So sedentary just means someone um a life without activity, let's put it that way, or without sufficient level of activity. So maybe you're sitting all day, you're lying down all day, you're just there, and you're not moving. So because you're not moving, the synovium is not being produced as it ought to. Your the health of your muscles, even the properties of your muscles, the way they are supposed to be used to exchanging your oxygen and carbon dioxide, everything, all those things are not taking place as they ought to. Yeah, and those things end up reducing the potency of those muscles. Yeah, sorry about that breaking transmission. Yeah, you need your back for everything. Yeah, so for the knees, there's excessive body weight. Like I said, the knees bear a lot of weight of the body. So if you are giving the knee more weight to bear, you can't blame it for eventually crumbling. Ehen. Yeah, so there's weak hip or thigh muscles. So the thighs themselves, they also carry the body weight. So when the thighs are weak, it's just hmm, it's like when you are carrying something with someone. Let's say you're carrying a table with someone, and then the person is not strong. So the person's side of the table is coming down. You are now having to do a lot of work, that kind of thing. So that's the way it is. Yeah, because it's supposed to be a collaboration. Then there's overuse from repetitive motion. When you carry out the same movements every time, and this is even, yeah, many times more than you're supposed to. When poor footwear, this table is a very very serious table, because there's a way that the feet was designed to be on the ground. There's a way the feet was designed. So our ladies in heels we're coming for that table very soon. Yeah, then there's bad walking and running form, and of course previous injuries. Next slide. absolutely one's nature of job can be. Yeah, it can be. So yes, let's talk about pain. So I know pain has a very terrible brand, and I know everyone here talk about how to relieve pain. But pain is your friend actually. Pain is your friend. Pain helps you. If not for pain, we would probably die much quicker. Yes, and we would live very terrible lives. We would just our 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 body communicates to us through pain. Yeah. So it's a system that I believe God puts in there as a guide. You understand? Yeah, sorry about that. Yeah, sorry about that. Okay, so yeah, so low back pain is often linked to bad posture and poor movement habits, and knee pain is often related to excessive load bearing, joint wear and tear, and thigh muscle weakness. So thankfully, you don't have to be an expert. So like I said, there's this this pain, this thing I'm preaching that you should, do something about your health quickly. I believe that pain helps to present an argument better than us. Yeah, better than anybody can. I mean, we'll talk and we'll talk, but as far as it's the pain that you feel that is going to drive you to do something. So, pain is the body's alarm system. It's a necessary guide onto health. Next slide. Next slide. Yeah, so risk factors for these. Okay, yes, sedentary lifestyles. We've talked about this. Long hours sitting or standing. Yeah, a major. This I should probably explain this. That when you subject the body to a particular position for a long period of time, it's eventually exerted so much because, like I said, there are muscles that are keeping it in that position. So those muscles are exercising. It's like they are doing an endurance. It's like you are jogging for 40 minutes or you're jogging for 60 minutes. You don't just see it because it's not like actual jogging. That's why. But that's the way it is. So that's that. Aging and joint degeneration, of course, and with aging comes the gradual loss of the ability to produce new cells. Yeah, to produce new cells. So eventually some things are lost and they're not replenished. Things are always lost. Actually, there's always joint degeneration from childhood till now. I mean, that's how we even, that's how we grow in some way. But yeah, this yeah, in adults the replenishing doesn't happen as it ought. There's been overweight, of course, like we've talked about already. Inappropriate footwear, poor work ergonomics. Ergonomics speak to the relationship between a person and their environment. So saying poor work ergonomics is talking about poor relationship between the person's body and their environment. So that's like improper chairs are not suitable for the spine, tables not suitable for the it's still for the spine. I mean, it's still the spine that gets affected, and so many other things. Yes, so there's repetitive bending, lifting, or twisting. Next slide. Yeah, so prevention strategies. So I'll be talking in depth on all of these things. There's um, learning good posture. There's learning good movement habits. There's learning good lifting techniques, strengthening concerned muscles, maintaining a healthy body weight. So we're talking on the good posture now. Next slide. Yeah, so there's a way to sit. There's a way to sit. You don't just sit anyhow. You don't just throw your body on the chair like that. If it's not loaded appropriately, it's going to cause a problem. So you have to sit upright. And this is the 90-degree rule. The back, the angle between the back and the legs or the thighs, let's call it the thighs. The angle between the back and the thighs are supposed to be 90 degrees. So that angle where your buttock is, it has to be 90 straight. Then your thighs and your shin, basically your knees also, are supposed to be at 90 degrees, and your ankles are supposed to be at 90 degrees. So your hips, your knees, and your ankles are like 90 degrees. So it look like a kind of staircase. Hmm? Straight, I mean vertical, horizontal, then vertical, horizontal. That's the way it's supposed to look like. Your back is supposed to be rested on the chair. When you sit down without resting your back on the chair, you are giving your back work to do. So that's not a posture that is supposed to be sustained for long. Yeah. So you need to adjust your table and chair height in a way that you can sit in that position while working. You have to. There are so many things like some tables, for instance, you can't put your legs inside. So because you can't put your legs inside, you now have to bend across, or you have to sit at the edge of your chair and you will not rest your back, or the chair is too high, or the chair is too low. One thing or the other, sir, you will not be having awkward angles and then you know problem, low back pain. Yes, so you have to use padded backrest in chairs. You have to keep your knees and feet leveled. They're supposed to be at the same level. Yeah, your feet are supposed to be flat on the ground. Then stop slouching. It's an exclamation mark on purpose. So nothing like, oh my god, I'm so tired. Eh, let me just stretch my leg on. It's not. Yeah, it's not right. Next, please. Next slide. Next slide, please. Hmm. Unless it's my network. Could it be? Could it be my network? Could someone give me feedback if it has changed on their own end? Next slide. Okay, okay. It might be a network issue. Alright. So yeah, the next is about lying down. So let me just begin talking about that. Yeah, so okay, I actually put a picture of how to sit there. So maybe when the slides are back up, we'd see that. But yes, there's sleeping. There's how to sleep, and there are three ways. Let's say there are three basic positions in which a person could sleep. You could either sleep on your back. You could sleep on your okay, not change it. Yeah, you could sleep on your back. You could sleep on your chest. You could sleep on your side. It does basically. Let's just leave it at that level. So if you're sleeping on your back, yeah, you're supposed to put a pillow beneath your knees. It helps to reduce the amount of effort that your back would require to maintain the curve while you sleep. While you sleep, you can still be giving yourself work. Yeah, your consciousness is offline, but your body still is still working. It's still it's still doing something. That's why you might wake up and you're feeling pains when you did not go to the farm or you did not go on ward round or something. Yeah. So sleeping on your back, it's advised that you put a pillow beneath your knees. Just that's all. Yeah. Just put a pillow beneath your knees. It takes a lot of work off your back. If you're sleeping on your chest, it's advised that you use no pillows. And I know how it is preached that I mean if you go to a hotel self they can give you like four pillows for it to just be there. But if you're lying on your chest, your it's advised that you do not use a pillow unless maybe when you now lie on your chest like that. It's I mean that's hardly going to happen unless the place where you're placing your head is lower than where the rest of your body is. When you use a pillow like that, the arc the arc of the lower back is accentuated, and to maintain that is work. Yeah. So again, you're going to be giving yourself work while you sleep. Okay. The slide is there. I hope we're able to see the one on sitting. Yeah. So you see that elbows side, yeah, feet on the floor, hip at 90 degrees. Just those are basic um, directives. So we can move forward. Yeah. So putting a pillow between both legs. If you're lying by the side, yeah, put a pillow between both legs. That takes burden off your back as well. Okay. Okay, let's move on quickly. Next slide. So yeah, you can just see that that's that's how it's supposed to be lying on your side in particular. I think the other ones are straightforward. So let's move on. Resetting the movement culture. Yeah. So yeah, motion is the joint lotion. So keep them moving. Yeah. So alternating positions, like I said earlier, you shouldn't maintain one position for too long. Um, so you might need support sometimes. It's like using a lumbar corset in English. A lumbar corset is like, when you guys go for Owambe, I'm talking to the ladies now. You guys go for Owambe and you're snatching your waist. Snatch it, baby. I once heard someone say, yeah. So that's what it does. Yeah, it snatches it, and that takes the weight off the spine, the weight of carrying the body's weight. But this should not be abused, and you're definitely supposed to even have a physiotherapist recommend when you should use it, um, depending on your condition. Yeah, depending on the condition. So, but it's advised that you use it when you have to do activities that would require some strain on your back. That's when, for the lumbar corset, for the knee brace as well. Yeah, for the knee brace as well. So ensure healthy transitions when changing positions. You don't just stand up from your bed like Undertaker. You just like you're lying down. Let's say on your back, and then you just rise. Like you just you just come and sit down. Like you just sit up like that. No, that's too much work for your spine. So you're supposed to turn gently to your side. You turn gently to your side, and then you use your hand to support yourself while you come up. Yeah, I would have loved to demonstrate that. It's very simple, but it's when you go into sitting abnormally like that every single day, it's little drops of water, but you are building an ocean of problems in the end. So just don't get up like Undertaker. Turn to your side, then you could use your elbow on the bed to just push yourself up, and then you sit up. That's all. When you're sitting down as well, you don't just throw yourself on the chair like that. You just throw your weight bah, on the chair. No, gently you sit down at the edge. You even if there's a handle on the chair, you hold on to that handle and you put your buttock on the edge of the chair. Then you move into the chair. So that's how to stand and how to sit or how to come from sitting into while lying. Then you should use cushioned footwear with arch support. Yeah, the shoes that we wear. I don't think a lot of people are more concerned about structure than function. So they're more concerned about how nice it looks than how functional, how tailored that thing is for the body. And I'm hoping that if there are any people who know shoemakers or have some inspiration on starting a shoe company, this is a burden that you can take on. And please tell them that they should have mercy on our feet, because it eventually has a consequence in our low backs and our knees as well. So yeah, minimize the use of heels, ladies. Please, yeah, please. It puts a lot of strain on your knees when you put on heels every single time. Every single time, it puts a lot of work on your knees. So please, you can minimize that as much as possible. Thank you. Next slide. Yeah, proper lifting techniques. So you do not bend your back when you're trying to lift something. I know that's yeah. I found out too. I mean during my during school. Yeah, but I'm not supposed to. But I've been doing it wrong all my life. You're supposed to bend down at the hips, at the knees. You bend like you're squatting down. That's how to carry. That's how to bend. If at all you have to go down, even to tie your shoelace, that's how to bend. You don't tie your shoelace by just keep your legs straight and then you just bend your back and down. No, it's not right. I would in the image you're going to see the image in the next slide. Yeah, so you keep the object close to your body, avoid overreaching, you avoid twisting when lifting, use assistive tools when necessary. Like, there are many hoists, wheelbarrow. You don't take up more than your spine is designed to carry. If it's too heavy, please call for help. Yeah, please call for help. Please call for help. Yeah. Next slide. So yeah, so that's so that's a wrong way to live. So you see, just bend your back like that. You know, it's very wrong. You're placing a lot of burden on that back. You can look at the curve. In the diagram that we saw earlier, the curve of the lumbar spine is inward. It's let's just call it that. It's inside. It's curved inside. This is the direct opposite of that. You understand? So that's a problem. You see the right way. You don't have to bend your back in that awkward manner. You don't have to do that. So there are guidelines on the image there. Next slide. Yeah. So preventive exercises. So you have the pelvic tilt. I'll just run through them. Yeah, they are all in the images. Yeah, the pelvic tilts, the bridges, the calf cow stretch, straight leg raises, then daily low impact activities daily. Yeah. So the little walking, jogging, in swimming. I know we might not have, none of us might not have access to pools, but I mean, we have some Olos in our midst. Amen. So yeah, if you have access to a pool, please use. The swimming involves virtually all your muscles, so it's the best way. Yeah. So for the knees, there's straightening the knees while sat on the chair. I'll show what that is as well. Um, there are mini squats and aerobic exercises for weight loss. This weight loss thing really takes care of. If there's not much weight, we hardly have an issue with the knees actually. Yeah. Next slide. So I'm going to have to move fast with this one. So yeah, this is the pelvic tilt. So you can see that you're lying on the bed, and in the first one, the back is arched upward, is arched upward, and then you bring it down as if you're trying to push your back inside the bed. That's the feeling. So you just do that up, down, up, down, up, down. You could do that 10 times. You could do that, you know, 10 repetitions of that 3 times. Like that's 3 sets of 10 reps. So next slide. That's the pelvic tilt. Next slide. So yeah, this is bridging. This particularly helps with the strengthening of the core muscles. Yeah. So it's explained in that diagram. This is the cat cow stretch. Yes. I mean, we have a lot to learn from the animals around us. So this is one of those. So it's as described here. It's bending the spine, that outward inward curve, alternating that's the cat cow. Same repetitions. So most of these exercises they can have the same repetitions. Next slide. Next slide. Yes, the straight leg raises. So one of the legs should be folded, as you can see. One should be folded while the other one is straight and it's raised up. And you'd hold it for about maybe 5 to 10 seconds, depending on your tolerance. You raise it for 5 to 10 seconds, you bring it down. So you can do that. You can do that. You can do that 3 times. You can do that 3 times. Yeah. So this is the leg raises in high sitting for the knees that I talked about. So these strengthen the quadriceps. They are the thigh muscles which help to carry. Remember, if the thigh muscles are weak, then the knees would have to bear more work. So this is a way of preventing or countering that. Next slide. So you basically hold it in that position for a few seconds, bring it down, hold it up for a few seconds, then bring it down. So these are mini squats. You don't have to go down so much. Yeah, just using that level of bend is enough, as in that image. Next slide. Yeah, swim more, guys. Yeah, so what to do when you feel pain? So, well, you need to rest. That's the main thing. You need to rest. But there are a few things you could do to relieve the pain in that particular moment. There are the knee to chest exercises. So the knee to chest exercises are you lying on your back, and you lie on your back, then you fold your knees up in a way that they are almost touching your chest, and you can just use your hands. You put your hands behind your thighs to keep them up. It helps to open up the space in your back. but it shouldn't be so excessive that the thighs are now, maybe your back is now rising up. Your back should still be on the bed. Yeah, it should still be on the bed. So the child pose, all those ones, you'd see them in some images. The cat cow stretch is already shown. The pelvic tilt are shown. The lumbar support, yes, that's it would take the weight off your back. For the knees, you rest it, elevate your knees if they are swollen. Just yeah, keep them elevated. If you're sitting on the chair, you can place your knee on another chair. You put on knee braces, they would keep them stable, and you need to rest. For the knee in particular, if you're having knee pain, rest. Just go and don't worry. There's nothing you want to do. Just rest. There's nothing. Just go and rest. Yeah. Next. The next slide, please. So this is what the child pose looks like. So these are things you could do when you have that low back pain immediately. So child pose. Next. Next slide. So yeah, when to see a physiotherapy. So these are, like I said at the beginning of this, there are little things, they're little small 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 fry that they call it. These are the little things you can do by yourself. So after having exhausted these things, there are some things that you would see that would not let you know that, okay, this has gone beyond that little that I can do, and I now need to see a specialist. Oh, this is more than just changing a light bulb. Or this is just more than, maybe changing my tap handle. Or for me, I don't know. It's a problem that I need to call, a plumber or an electrician for. So when you see a pain that lasts and it keeps coming back, please see a physiotherapist. If you have difficulty with movement or daily activities, you are unable to do the normal things that you should be doing. You are unable to walk distances that you should be able to walk. You are unable to maybe even properly maybe cook. You're unable to be in the kitchen for a long duration or something like that. Little activities, your day to day, your work, you're unable to perform your work as you ought to. Maybe you're a tailor, you're unable to sit for a period that that you should be able to, and things like that. You need to see if it's, remember, this is after you've taken all the prevention strategies that we've talked about. So it should not be that a tailor was saying, no, I must finish this dress, and I must finish this dress. You now sat down on the chair for 2 hours. We're not talking about you. We're not talking about you. So what you need to do is take breaks for that one. After 30 minutes, you stand up, you walk around, you come back, you continue. Don't sit down for 2 hours. There's no deadline that is more important than your back. So yeah, after an injury or a surgery, if there are noticeable weaknesses, poor balance, or a bad posture, um, and yeah, to prevent future pain and just move better. So the next slide. The next slide. Yeah, so the role of physiotherapy. I mean, when you do come for physiotherapy, though this is already beyond what you would do in your home, so there'll be a thorough assessment to relieve your pain and address its source. Remember, your pain is an ally. So we're not trying to combat the pain in itself. We're trying to combat the reason why the pain is talking to us. That's what we're trying to do. It's not just pele pele. We need to know what is going on. So there's education and the postural training. There's therapeutic exercise and manual therapy. Manual therapy is, the contact, what you might call massage. Yes. So the use of supportive devices like braces, like I mentioned some of them already, walking canes. Some people might not be able to walk without using a cane or using frames anymore because their body can't bear that much weight anymore. So either it's chronic back. This is mostly in elderly patients, so or elderly citizens. They are unable to endure walking, and the use of adjunct modalities, heat, cold, or therapeutic electromagnetic waves. There are a host of equipment that could be used to combat those things. So next slide. Yeah, so our pain. So this is speaking to the not just to the individual, but as a community. Yeah. So pain limits our ability to serve one another. If I'm a physiotherapist and I have back pain, I can't treat you. Yeah. So a nurse that has pain, she can't serve you. Yeah, a nurse that has pain can't serve you. I mean, she too, She probably needs to be treated herself. So in the end, the pain of one is the pain of all. If your driver, your keke driver is in pain, he can't save you. If I mean, even if your mom is in pain, she can't save you. Yeah. If your child is in pain, can't save you. If your sister or your friend is in pain, he can't save you. So really, in the end, we can't just it affects all of us in the end. Even if you're thinking about yourself and you want to be selfish, the selfish thing to do is still to care for everybody, because last it will touch you eventually. Yeah. So you can share this, all that you've heard with everyone that you can, your friends, your family, your colleagues, and even strangers. Yeah. You can see a keke man, not resting his back, and you just tell him that, hello sir, I think your back should be rested. Or really, you see anyone not sitting, you see your colleague at work not sitting appropriately, just tell them to sit right. Tell them to sit right. Or you see your roommate sleeping in abnormal positions that would cause pain, please tell him or her to sleep well. Yeah. Tell them you see someone sitting for long. Oh, this tech, this code, I must type it. I must type it right now. You know, and I must do it even if I have to sit down for 5 hours. You can use a good ergonomic chair, but if you still sit down for too long without standing up to at least pauses, give pauses for your sitting down, you're still going to end up coming down with serious pain. So please, this is a very very practical thing, and it's a topic that touches everyone. So I hope that we would share this with everyone. So yeah, in conclusion, yes, so low back and knee pain are common, but they are not without solutions. Praise God. Small daily actions make a big difference. Prevention is cheaper and it's easier. It's easier than treatment. Don't wait for your back to escalate before your pain rather to escalate before you take action. Don't wait until you are now unable to do basic things. You are now unable to sit down. You can't even sleep again. That's when you're like, okay, let me let me come and see the physiotherapist. You know, yeah. Don't wait for that, and don't forget to share what you have learned. So thank you very much. Sorry for far beyond the time I was supposed to. You could go to the closing slide. Yeah, so you were made to move. So please, yeah. Thank you very much for having me. Thank you for listening. Um, yeah.
Thank you so much, sir, for coming on here to preach the good news of preventive care and its management. I'm really glad I'm a part of this webinar, not just as a host, but I've learned a lot of things, especially as a nurse. And I know that my co-workers, my colleagues are here tonight. Proper lifting techniques. We get to lift patients from the bed, from the wheelchair to the bed, transfer patients, a whole lot of things. Sometimes when we do wood dressing, we serve medication, we do these things with let me say at a posture that is really not correct from what you've said tonight, and I really really learned a lot. And even from the comment section I can see that a lot of people are were blessed. I say we're blessed by this presentation. Thank you so much. I do not take it for granted. On behalf of myself and the whole team Favorite Nurse, we are so grateful. So I would like to take questions. Would like to take questions. So before we take questions, please, I want you guys to like appreciate physiotherapist Ayodele. It was so busy and engaged, yet he created time for this webinar. So Gift Joseph is saying, what causes pain in the shoulder after a stressful day without lifting weights or heavy things? And what can athletes do to prevent knee pain? I don't know if
Okay, yeah,
someone okay.
yeah. So well, for shoulder pain, like I said, But you're not lifting heavy weights, but you were carrying little objects throughout the day.
Yes.
Yeah, you wrote. You probably wrote with a pen throughout the day, and it might look like just using your hand or your fingers to write, but every movement that you see. Okay, I think there's a feedback from our host mic. Okay, so every movement that you see at the end of your limbs, for instance, in the hand, maybe I'm trying to drink water from a cup. My shoulders, the ones that are proximal, the ones that are closer um to the when I say trunk, I'm talking about like the chest, that region. They are all acting, all of them, they are working. So even if I'm putting a thread through a needle, my shoulder is working. So that's just to clear up the misconception that, oh, because I'm not lifting weights, with my shoulders, they are probably not doing anything. They are doing a lot of work. If your shoulders were not working, then they would have probably gone lean by now. Because if a
Mm-hmm.
muscle is not activated, they would die. They
Yes.
would die. So its very existence is proof that it's doing something. So how to relieve it? The best thing, of course, there are two things that I will just mention. Number one is the proper ergonomics, like I have already mentioned. Yeah, the ergonomics. So if you, for instance, if you are writing on a table that is much higher than you are supposed to write, what's going to happen? You're going to elevate your shoulders. You're going to raise your shoulders up because you're trying to catch up. So that might look like a
Yes.
small movement, but if you're doing that for hours, you're writing and you're writing for hours. You're standing and you're writing. Maybe you're in clinic, hmm, and you're writing for
Mm-hmm.
hours in a position that is not optimal for your shoulders. What's going to happen? You're going to have pain at the end of the day. Yeah. So
Yes.
number one thing to do is to prevent that cause. Yeah. So abnormal placement of your shoulders as much as you can. Ensure that the basic activities that you do them in good posture. Yeah, don't reach unnecessarily. Don't reach for things unnecessarily. Ensure that if you're writing or you're doing anything table related, it's
Mm.
at a good height, a height that can have your shoulders relaxed while you're doing it.
Mm.
Then there's the area of stretching. Yeah, so there are certain stretches you could do. You would just um for instance, you lock your fingers into each other and you could stretch your arms up, like you just stretch it up. I'm sorry, I would probably have described this or shown you with a video, but again, I apologize for being unable um
No
to show my
problem.
video at this point. Yeah, so up, to towards the front, you would literally feel the back. You'd feel your around your scapular region. That's the your upper back. You would literally feel it stretching to the front. So you still with your hands locked together. Your hands are locked together, and you are pushing your hands forward. You know what? You could probably even stand in front of a wall, okay, at maybe um not up to a meter, of course, maybe about, well, let's just say a meter or close to that, and then you try to touch the wall with your hands locked in to each other. Yeah, so you'd have to push push your hands forward as much as you can until you can touch the wall. So those are little things you can do. Even you can also lock still with your hands locked into each other. You put it backwards, and try to stretch that way. So but of course it has to be modulated properly. So you don't just do it. You can maybe hold that for like 10 seconds, before you repeat it. You can do that 3 times for each pattern of movement. So that's for the shoulder pain. Then yeah, what can athletes do to prevent knee pain? Yeah, so knee pain, like we've already identified, is caused by um an overexertion. Yeah, it's caused by an overexertion and also the weakness of the muscles that are supposed to carry the body's weight. Yeah. So athletes, for instance, would have to really, really work on strengthening their quadriceps muscles or their thigh muscles. So the little things that we do, it's based on your job description. Your job description is going to is what is going to determine the requirements of your body. So I that I might not necessarily have to do some things that an athlete would have to do. So the athlete should even be in a gym. Okay, well, if you're speaking about a casual athlete, there are these things called sandbags. Okay, they are called sandbags. It's like as the name implies, it's like you're pouring sand into a bag. Like these dusters that are the point is for you to be able to strap it around your ankle, basically. Yeah. So that serves as weight. So when you when you raise your in sitting position, that's one that I showed you earlier. I've forgotten the slide number, but where the person is sitting down on a chair and then raising their legs up straight, the muscle that is triggered in that particular movement that is isolated and is triggered are those thigh muscles of the front, the front of the leg. Yes, so that particular muscle is strengthened by that. So if you tie the sandbag, around your ankle and you raise that leg up, you know, let's say you raise it up 10 times, um, yeah, that would the weight would definitely depend on the weight would depend on the level of tolerance of the person in question and probably their goal as well. The goal that they are trying to reach or the requirements, the level of strength that is required for that sport that they are having to play. So that's a major that's a major thing. Yeah, that's a major thing. Um, I would leave it at that. I would leave it at that. Yeah, so that's basic way of preventing the knee pain. I think there was a question that someone asked earlier. Our host might have some um, network issues at the moment. I can't see how. There was someone who asked a question about her job. Okay, I think that was a while ago. Yeah, someone asked a question about her job having demands, um, having demands that affect the back and the knees. And yes, definitely, there are some jobs that would require you to be in a position for a long time, or require you to make the same movement for a long time. So you'd have to counter that, for instance, by taking breaks from the prolonged position or even taking breaks from that repetitive movement. So you don't just do it for hours and keep going. No, you have to break it. You have to break it. You have to break it. That's all. And once you do that, mostly you're fine. But when it's just sustained like that and without end, it's a problem. Yeah. So that's that. Are there any other questions? Okay. I don't suppose that they are. Um, I don't suppose that they are. Okay. Okay. Yeah. But I hope we've learned. I hope we've learned something important. Well, maybe while we wait for our host to return, if we could just type in the comments one major thing that we will do after this, one major change that we're going to um imbibe, we're going to implement, what we will do after this, what we will change after this. I think I'm also going to type my own. I'm not seeing our commitment. Okay. So we might have to close this now. So thank you very much, um, Team Favorite Nurse, for inviting me once again and for organizing this and for organizing these programs that equip everybody in the community really to live better lives at their own levels without necessarily having to come down to a hospital. It's a necessary service, and thank you very much. And thank you all for also feeding to their call. Okay, as the law says, upon waking, I will rise from my bed by turning to my side and supporting with my arms. Very good. I will also do that. I think I wake up like Undertaker sometimes, so I'll repent from that. Yeah. Okay. All right. So thank you very much, everybody, for showing up. We'll be ending now. God bless you all. Pray that you have um, pain-free days, and when you have pain, that you will hit its communication. All right. Bye, everybody.